name's Dr. Chung. I practice right down the street, actually, on 3300 East South Street. And I'm in a group of 8 hematologists, oncologists. Hematologists meaning that we're subspecialists or specialists in all things related to blood. Oncologists, all things related to cancer, head to toe. So today's talk, they've asked me to talk about breast cancer and sort of some of the key issues that arise right now. You might have seen breast cancer screening guidelines changing in the news recently. Over the last few months, the U.S. Preventative Task Force has released a statement saying that they did not think women between the ages of 40 and 50 needed mammograms routinely at screening. So we'll talk about that. So why breast cancer? Why talk about it? Why is it important to discuss today? There's a lot of new cases of breast cancer diagnosed in the U.S. They estimate over 200,000 new cases. New women and some men too will be diagnosed with breast cancer. And they estimate over 40,000 of those individuals will pass away as a result. Now, breast cancer is the most common cancer in women in the U.S. It is the second most common cause of death in women after lung cancer. By the time a woman is 85 years old, her risk for developing breast cancer will be estimated to be 1 in 8 women. The incidence has increased. More and more women, year to year, have been diagnosed with breast cancer, and yet the mortality, the death rate, has gone down, which means we must be doing something right in terms of diagnosing it, in terms of treating it. So cancer in general. The key thing to know about cancer is, number one, where does the cancer start from? Because I have patients come into my office and they say that they have someone in their family with bone cancer, but it actually turns out it started in the lungs and had gone to the bone. So it's not necessarily bone cancer. I'd consider that lung cancer. So for any type of cancer, the number one thing to know is where does it all start from? Because every single cancer is different in terms of how it behaves, how quickly or slowly it progresses, and is different in terms of how it's treated too. So it's always important to know the site of origin. Normal cells, they should behave in a particular way, right? They should grow, they should die, everything should be relatively controlled. When cancer happens, the abnormal cells continue to grow abnormally, right? And the cancer may start in one place and could eventually spread to other places. And we'll talk about what that is called and what it means. So just to highlight, it's important to know where the cancer starts from because that'll dictate what to do with the cancer. Now about breast cancer, what is the normal structure of the breast? How should our breast look like on the inside, right? And you can imagine it looks like a cluster of grapes, almost. It's mainly fatty tissue, right? Your breasts are mainly fat. And it has a network of lobes, tiny tube-like structures called lobules that contain milk glands. And tiny ducts connect in between the glands, the lobules, the lobes, right, and carry the milk from the lobes to the nipple. Throughout the breast, we have blood and lymphatic vessels. And majority of the time, 90% of the time, the cancers start within those ducts or lobes. Right? So that's how a normal breast should actually look like. Now, everyone might wonder, and a lot of people come into my office and ask, what is my risk for having breast cancer? My relative has it, or my friend has it, and I want to know, am I at high risk? Right? So here are some of the major risk factors for breast cancer. The number one risk factor is age. As we get older, especially in women, the risk goes up as we get older. Right? So there's an association with age. There are things that we can inherit amongst family members. There are genetic conditions, and the most common or most important one to know about is something called a BRCA mutation. A mutation inside of the body where if you have it and it can be passed along, family member to family member, it puts you at a very high risk for not only breast cancer, but other things such as ovarian cancer. So that's another risk factor. So if you had a family member with a history of a BRCA mutation, that's hugely important for you. Carcinoma in situ, both what's called lobular carcinoma in situ and ductal carcinoma in situ are not considered cancer in and of themselves by most oncologists. They're actually considered, at least DCIS, ductal carcinoma in situ, is considered a precancer. If left long enough inside of the breast, it can develop into invasive breast cancer, what you commonly think of as breast cancer. Lobular carcinoma in situ is abnormal cells, which puts a person at higher risk for developing cancer. So these are other things which raise your risk for having cancer, breast cancer. There's another abnormal type of cells called atypical ductal hyperplasia, which can sometimes be found on biopsies that also put women at an increased risk for cancer. Anything that increases your exposure to estrogen puts you at a higher risk for breast cancer. So having your periods at a younger age, not having any children, having your first child late, having a late menopause, all that prolonged exposure to estrogen could put you at an increased risk. When you start having your menses or periods, if that developed late teens, that'd definitely be considered late, for example. If you didn't have any children, if you had children late, as in late 30s, 40s, that'd be considered late. Having the children early is considered actually somewhat protective for having breast cancer, but it does not mean that you will not have breast cancer. Obesity. Women who are overweight, because the fat tissue contains or increases your estrogen levels, that's also considered a risk factor. Women who received estrogen replacement, that's considered a risk factor. Having a family history, and this is where a lot of patients will come in and ask, well, I've got one aunt who had breast cancer at the age of 80, how high is my risk, right? The main thing is two things. One is how old your family members were, right? So the younger they are, especially under the age of 50, the higher the risk. And the other is how many members in your family were affected. So if you had one aunt, for example, age of 80, probably not as strong a risk factor as if you had 3 sisters, all in their 40s, which will happen. People will come into the office and say, I've got 3 sisters, all in their 40s or 30s with breast cancer, what's my risk? That's pretty high, right? And female gender seems obvious, but there are men who can also have breast cancer. Not as often, definitely not as often, but men are also sometimes at risk. Other things are a previous history of breast or ovarian cancer. So women with breast cancer, and they had their surgery and they're, quote, cured, they're still at risk for having breast cancer in the future. Their risk for breast cancer never goes down to 0. So that's important to know. That's why surveillance and screening and keeping a close eye on patients with a history of breast cancer is so important. Lifestyle, excessive alcohol intake, lack of exercise, high-fat diet, those all play a role into it as well. So these are some of the more established risk factors for breast cancer to know. Now, to go back to that BRCA mutation, that genetic condition that is passed along from family member to family member, it's not very common. Very few women with breast cancer actually have it, but when you do have it, when you are diagnosed with it, it can allow you to have, as written there, a 50%, 85% of developing breast cancer in your lifetime. That's a very high rate, right? So the main thing is, if you're a young lady, and young is 40, below, definitely under 50. If you're a young lady and you've got multiple family members, this might be something to bring up to your doctor. A lot of people ask me, well, how do I know if I have breast cancer? So, lumps, thickening in the breast, under the arm, tenderness of the nipple, discharge, especially a bloody discharge. Those are all things that are worrisome. Skin irritation, redness of the skin, which doesn't go away, puckering, dimples of the breast, scaliness, new creases, pain, all those things are things to be wary of and to bring up to the attention of your doctor. Pain in the breast is usually not a symptom of breast cancer, but it should also be reported. Anything in the breast that you think is just not normal, bring it up to your doctor so that we can take a look and run some tests if we think it's appropriate, right? And a lot of the times, women will come in with newly diagnosed breast cancer and no lump or mass can be detected. That's oftentimes when a screening mammography turns up a small lesion or even a large one inside of the breast. Sometimes we just can't feel it.